Recent research findings have shown that an easy change in diet can reduce high blood pressure and prevent such diseases as heart attacks, heart failure, stroke, and kidney failure. High blood pressure, also known as hypertension, is a condition in which the pressure in a person's blood is too high. This condition is common, but it is dangerous if it is not treated. It can cause serious damage to the heart. It may result in heart attack, chest pain, heart failure, stroke, and kidney failure. According to the World Health Organization, about 1.28 billion adults between the ages of 30 and 79 have hypertension worldwide. Two-thirds of these adults live in middle and low-income countries. About 46% of adults living with hypertension are not aware that they have this condition. Hypertension is a major cause of premature death throughout the world. Most people living with hypertension do not experience any symptoms, so the best way to stay safe is to get yourself checked regularly. However, according to the World Health Organization, common symptoms may include chest pain, dizziness, difficulty breathing, severe headaches, nausea, vomiting, blurred vision or other vision changes, anxiety, confusion, buzzing in the ears, nosebleeds, and abnormal heart rhythm. Eating too much salt is one of the major factors responsible for why people develop hypertension. For this reason, people with hypertension are often told to cut salt intake. A recent research that was just published in the journal Hypertension shows that it has been difficult for people to reduce salt intake because changes involving salt intake are too hard to implement for people. The authors, however, point out that there are easy ways to prevent hypertension. Here's how. The type of salt that may lead to hypertension is the sodium-rich salt, which is the regular salt that we all use. Much healthier salts are now available that can be used in place of the sodium chloride salts that we use every day. These are potassium-enriched salt and sodium-reduced salt. Potassium-enriched salt is particularly fascinating because most people do not perceive any significant difference in taste. This means that potassium-enriched salt can easily replace the regular sodium-rich salt without people noticing a change. However, potassium-enriched and sodium-reduced salts are not widely available. A study published in the journal Jamir Public Health Survey in 2021 shows that these salts are only available in 47 countries worldwide. In sub-Saharan Africa, only South Africa has these salts in the market for people to buy. It appears like more has to be done so that countries like Nigeria, Ghana, Zambia, Cameroon, and other developing countries can have access to these salt substitutes. It should be noted that you need to talk to your doctor before you change your salt intake. Whether or not you will use these alternative salts and how you will use them will depend on the state of your health. For example, people who are at risk of developing high blood potassium levels, hyperkalemia, and people with kidney diseases may develop complications if they switch to potassium-enriched salt without a doctor's guidance. This is why it is extremely important to talk to your doctor before making any major changes in your diet. It should also be noted that apart from a high intake of sodium-rich salt, other factors that may lead to hypertension, according to the World Health Organization, include high intake of saturated fat and trans fats, low intake of fruits and vegetables, physical inactivity, tobacco and alcohol consumption, being overweight or obese, having a family history of hypertension, being over 65 years old, and having diseases such as diabetes or kidney disease. Have you ever heard of potassium-enriched salt and other salt substitutes? Have you ever used these alternative salts? If these salts are not available in your country, how do you think your country can get them? Let us know in the comment section. Follow us for more updates.